Healthcare.gov, the website, is far from perfect. It is getting better every day. We have had new talent in technology come in. We have new management talent in. We want it to be a smoothly operating marketplace for every American who really needs affordable health care.
That was the embattled Department of Health and Human Services Secretary Kathleen Sebelius Friday announcing that the government has hired a brand new geek squad to come to rescue of the faulty federal health insurance exchange. Joining me now from Atlanta is a person who knows a lot about a team of geeks, because he used to be one of them. Clay Johnson is the CEO of the Department of Better Technology and author of The Information Diet, also a former Presidential Innovation Fellow, the same group that the administration is now bringing in to help troubleshoot Healthcare.gov. So nice to have you today, Clay.
Thanks for having me.
So just in the simplest terms that even nerds can understand, even though we're not geeks, what is wrong with the site?
Well, it's an interesting question. A lot has gone wrong with the site. The first thing that's wrong with it is clearly the people who made it aren't very good at programming. You know, any programmer, if you've ever opened a web browser, sometimes if you just sort of explore the menus, there's this menu item called View Source, and you can click on that and actually see some of the code that's running inside of Healthcare.gov or any website that you go to. And any developer that's looked inside of the source of at least the front end of Healthcare.gov has really, I don't know a better word than facepalm. Like they've really just. But I mean, what's really gone wrong here is that we've lost our management brains for technology.
Yeah.
And so in 1996, maybe it was 95, the Republican Revolution came and gutted Congress's brains. It was called the Technology Assessment Office, and it was this team of people who advised Congress on how to implement technology and how to implement technology policy. And that's why, you know, for me as a technologist, when I was watching the hearings the other day and watching the contractors who are really not qualified to do this work and the members of Congress who are really not qualified to ask questions on technology,
right.
All I could think of was like, this is like my one-year-old arguing with my cat.
Yeah, right. Right. I don't even want to know which one's the one-year-old and which one is the cat.
Right.
But let me ask, because this point that you just made, I think, you know, to the extent that there is some good that may come from all of this, it is in part sort of the American people starting to ask questions about how common this kind of contracting is, where you are saying to me, look, there are folks doing this work who simply are not qualified to do it. I can just look at how the code is running and immediately sort of notice, wait a minute, this is from, you know, 94 or some other ridiculous time period. How common is that as a part of the problem of how government projects in general happen?
These failures are the rule, not the exception. The Standings Group came out earlier this week, and did an analysis of all federal IT projects of greater than $10 million and found that 94% of them screwed up in some way, shape, or form, and about half of them failed outright. Generally, you know, federal IT projects done well are the exception, not the rule. These things always happen, whether it was Healthcare.gov this year, last year it was the System for Award Management, or SAM.gov, that cost $181 million and failed. And it happens at the state and local level too. New York City had City Time. It was about a $500 million project that ended up with some indictments. The state of California has a docketing system that's $2 billion and years overdue.
And Clay, there was this one moment where it seemed like that wasn't what was going to be happening, and that is during the Obama 2008 and the Obama 2012 elections. Those campaigns seemed so nimble when it came to technology, not only the use of kind of social media and new technologies, but actually being very good at how they sent out, you know, how to get everyone to click that red button and give their $10. Is part of what's going on here people just being astonished that our kind of digital presidency has not been able to deliver?
That's the big problem, is that the same people, that same kind of technology can't really get into government because there's this procurement policy. It's about 1,800 pages of regulation that keeps small businesses from coming in and working on stuff like Healthcare.gov. So the contracts are going to the people with the best lawyers, not the best programmers. Look, I was Howard Dean's lead programmer in 2004 for his presidential campaign, and I'm still waiting for that technology to make it into government. I'm still waiting for the companies that you know, built around that campaign to be able to work on government stuff, and they just can't because the barrier to entry is just too high, and it needs to change.
Clay, stay with us because I want to keep talking about this, but also talk about why, as much as that's an argument, it's not an argument for why you shouldn't have Obamacare. So I want to talk about the website Healthcare.gov, fixing that, and also what the real problems with ACA are. It's not what you think when we come back.
How the others must see the faker. I'm much too fast to take that test. Change it. Turn and face the strain. Change.
Okay, we're back and talking about the difference between the problems in ACA and the problems in the Healthcare.gov website. Igor, I want to play for you some sound from Frank Pallone from Jersey, talking about another time when there were glitches like this.
When Medicare Part D started up, and I have this chart here, there were all kinds of problems with the website. It went on for months. These are some of the headlines that appeared in the newspapers about the problems. But did the Democrats get up and say, oh, Medicare Part D is terrible, let's repeal it or defund it? No. We said, let's work hard to make it better, and that's what we did, and the glitches disappeared, and the program became a good program.
What's your response to that?
Well, this is an important point. A lot of Democrats opposed Medicare Part D. They thought it was too much involvement for private insurers. They wanted a different kind of system. But once the law passed and once the law became implemented, you had Democratic congresspeople from all over educating their constituents on the plans available, on the policies available, doing town halls to help people sign up for prescription drug coverage. And when in the first couple of weeks you had all these problems, particularly lower income seniors weren't able to get their prescriptions, the pharmacists weren't getting the correct information, the government had to delay the tool, the online tool they used 3 separate times because they couldn't figure out the technology. And Bush administration officials would come to Congress to explain what the problems were, just like you'll see this coming week. And Republicans said, well, we understand. This is a very big
Right. This is change is hard and slow.
This is going to have glitches, but in the end, you'll figure it out. Don't prejudge America. Give this some time to work. One congressman said, I've delivered a lot of babies in my life. He's a doctor. But this was the smoothest delivery I've ever been part of. Now, of course, he's calling for Sebelius to resign, or repeal of the entire law. It's not exactly analogous, and we don't know if the problems really hold up. Maybe there's deeper problems in the Affordable Care Act that we just don't know about. But it's just so, maybe expected that Republicans at these hearings, they can't seem to hide the glee with which they point out all these problems.
Right, about the fact that there's a broken website. Clay, let me come to you on this, because in this effort now and push to fix this, we're starting to learn about the contractors, one of whom, and this is, I think, maybe one of the most troubling things that I read this week, one of whom is owned by United Healthcare, which also owns one of the nation's largest insurers. It feels like we're going to get single payer, but not really single payer, but sort of, one nation united under United Healthcare.
This is probably the biggest failure of this Congress and last week's hearings was no one asked about stuff like that, or like the fact that CGI Federal lobbied for the passage of the Affordable Care Act. Not one member of Congress asked, hey, CGI Federal, what were you doing lobbying on the passage of the Affordable Care Act before you even had the contract? Nobody asked that.
And so I wonder, in part, because as we're thinking about the questions that aren't being asked, the general contractor who's been named to fix the website also came out and said that Healthcare.gov is fixable, and said specifically by the end of November, Healthcare.gov will work smoothly for the vast majority of users. Is that good politics or bad politics to set a deadline on it?
Well, I think it was, not only did he say that, but the administration's appointed official, Jeffrey Zients, also said that by the end of November, this is what we're going to have. And I think it's smart politics for the administration to at least say, we've got a deadline that we're working towards and we're going to make this goal. I think it's a miscalculation to say that the vast majority, what does that mean? And what does it mean that everything will be working? Because we also know from the Medicare Part D experience that they had a lot of problems, and they also didn't have that much enrollment until right before the deadline.
Right, that's how people operate.
And that's how people operate. I don't do my taxes until April.
Oh, April 13th. That's right. Yeah.
So we know that.
I mean, the one thing that's common between the website issue and the contractor issue, it's a problem with the healthcare law from the start, meaning it was a somewhat jerry-built system. It wasn't single payer. A lot of liberals criticize the administration, and it relies on various regulatory mechanisms. It relies on private health insurance companies participating, and so there were built-in problems, and there were all kinds of opportunities for Republicans to exploit. But I think the administration has, you know, an even greater burden than even with Medicare to get this thing to run because there's so many parts.
And it feels like that's when, we started with this notion of the kind of massive resistance against it. And on the one hand, there's a kind of hypocrisy associated with the problems that were also part of Medicare Part D, but it's also simply the hypocrisy of trying to break something, and then when it's broken, saying, oh, yo, it's broke.
Now pretending that you're concerned that it's not working properly. And in terms of the context, you know, not just with Medicare Part D, you can go way back to when we created Social Security. There were a ton of problems when it was created. I mean, think about it, to create a system when people didn't even have Social Security numbers to identify people with the same names in different parts of the country.
Passing out slips of paper.
Right.
Look, my favorite is how many glitches there were in, you know, founding the country.
Exactly.
You know, that whole Continental Congress situation, the whole working out of a bicameral legislature. It's hard.
It's normal.
It's normal. Right. And it's part of what, when you're working in a democracy, right? I mean, I can give you an efficient system, right? Just give me a dictatorial system. I can make it efficient for you, right? It's the nature of democracy. Yep. Clay Johnson in Atlanta, thank you. I hope you'll come back and spend more time helping us Geek Squad all of this.
Appreciate it. Thanks very much.
Thanks. Up next, for all the focus on the website and its problems, the website and its problems are not what is really the main issue with Obamacare. Believe it or not, the most important thing for Obamacare is that we need more Republicans to do what Ohio's John Kasich did. Seriously, this one time only, I'm going to say Republicans, act like John Kasich.